Ireland's COVID-19 vaccination programme is, I think we'll all agree, the most ambitious public health initiative ever undertaken by the state. Following the considerable sacrifices made by everyone in taking actions to minimise the risk of spreading the disease, the availability of safe and effective vaccines provides a beacon of hope for a return to some normality. The vaccines protect the lives of those most vulnerable to COVID and will allow us to again enjoy and see the value of things we once took for granted. By the end of last week, over 500,000 doses of vaccine had been administered. It's a significant milestone and a reflection of the hard work undertaken by thousands of women and men across Ireland who are working so hard to implement this programme. The focus to date has necessarily been on older people and healthcare workers. There are strong indicators that vaccination of this cohort is having a very positive benefit. COVID infection rates for hospital workers have fallen by about 95%. Staff absenteeism in the nursing home sector relating to COVID has fallen from several thousand to several hundred and continues to fall. And the latest serial testing results from the nursing home sector have a positivity rate of just 0.2%, something I think we can all welcome. Thanks to this, NPHET is today giving consideration to the protocols on visitations. I know this is hugely important to residents, families and staff. Minister Butler and I have been working closely on the issue and are looking forward to discussing the situation later today with the Acting Chief Medical Officer. The next phase of the programme, which started this week, sees vaccines being made available to those with underlying medical conditions that place them at very high risk from COVID. In addition, the programme this week is focused on second doses in nursing homes, a small final group of those aged 85 and older, including those who are housebound, healthcare workers for whom dose 1 will be finished next week, and some initial rollout to those aged 80 to 84. So a lot of activity going on around the country. There is understandably a lot of focus on vaccine supply, ambitious targets and optimism with regard to the pace of regulatory approval of vaccine candidates has come up against the reality represented by vaccine production and supply. This can make us lose sight of the merits of Ireland's engagement with the EU process. Ireland has opted into advance purchase agreements negotiated by the European Commission on behalf of Member States. Through this mechanism, we have advance purchases in place for 7 different vaccines. This includes the 3 vaccines currently being administered in Ireland today, a 4th, Janssen, which we hope will be authorised by the European Medicines Agency later today, and 3 others which are currently being reviewed by the EMA. We have pre-ordered a little under 18.5 million vaccine doses. It's enough to vaccinate every man, woman and child in the country twice. We're looking at options to increase this amount via the EU. Just yesterday, an additional delivery of the Pfizer vaccine was secured by the Commission, with Ireland due to receive approximately 46,000 additional vaccine doses this month, which obviously is very welcome. The terms and conditions of these agreements include a requirement that vaccine doses will not be made available for use until after the relevant vaccines have received regulatory authorisation. It has always been an underlying principle of the EU's procurement process that prior to administration of any given vaccine, assurances should be obtained as to the safety and effectiveness of those vaccines. Some have argued that Ireland should be seeking additional vaccine supplies outside the EU process, and it's a very reasonable question to be asking. I'd like to assure deputies that Ireland is in regular contact with the pharmaceutical companies, with the Commission and with other countries. It'll come as no surprise to colleagues that other countries are not interested in giving up their own vaccine supply while they're vaccinating their own people, particularly the most vulnerable, and Ireland, as I'm sure we would agree, would be in the same position. It'll also come as no surprise that the pharmaceutical companies themselves do not have as yet undeclared supplies of vaccines which are not being procured by the EU or other regions or countries around the world. The third argument which has been put forward by some is that we should use vaccines that haven't been authorised by our own regulator. The Russian vaccine Sputnik has been mentioned in the House on several occasions. The EMA is conducting a review of the Sputnik vaccine. However, it's interesting to note the comments of the Irish Times Europe correspondent yesterday, Naomi O'Leary, when she said, "The Italian factory announced as the production site for Russia's Sputnik vaccine for overseas orders is a small business that has never made vaccines and is not authorised by the Italian Medicines Agency." On the reliability of supply, Moderna and Pfizer have proven so far to be performing well. AstraZeneca is not performing well. It is repeatedly changing its delivery schedules, often at the last minute, and revising down the volumes that it had agreed to deliver. This is happening right across Europe. It is deeply frustrating for everybody, with so many people looking to get vaccinated as quickly as possible. We are acutely aware of the anxiety caused when these delivery schedules are not met. It should be noted that the Commission and Member States, including Ireland, are proactively engaging with the vaccine manufacturers to impress upon them our legitimate expectations that we have that the agreed allocations will be met, and that there needs to be an increase in supply accordingly. Some have characterised these shortfalls by AstraZeneca as the HSE missing its targets. This is incorrect. AstraZeneca is missing its targets. The HSE's target is to get people vaccinated as the vaccines arrive, and that's a target that they are consistently hitting. 95% of vaccines are being administered within 7 days of the vaccines arriving in the country. The HSE set out to vaccinate those aged 85 and older over a 3-week period. The rollout was not flawless, and there were GPs who didn't get the supplies on the days they were originally told. However, the vast majority did, and approximately 99% of this cohort were indeed vaccinated during the allocated 3-week period. As I said, the rollout was not perfect, and it's important we learn from this. I'd like to share with deputies additional measures that have now been put in place by the HSE to support GPs. A call centre has been established, dedicated relationship managers have been put in place, a regular GP bulletin outlining available vaccines is being produced, updates have been made to the order management system, distribution process improvements have been made, and the distribution ramp-up model has been updated based on learnings over that initial 3-week period. As of March 7th, 165,000 doses, of which over 65,000 were second doses, have been administered to residents and staff in long-term residential care facilities. A total of 262,000, of which over 84,000 were second doses, were administered to frontline healthcare workers. The estimated number of people to be vaccinated in the over 70s cohort is approximately 480,000, so just under 500,000 people. It's expected, subject to availability of vaccine supply as always, that everyone in this cohort will be vaccinated by mid-May. The impact of the vaccine so far is extremely positive. The evidence we're seeing here in Ireland, the evidence around the world, is beyond the most optimistic expectations that were being put to me just a few months ago. As more groups are vaccinated, options will become available to modify or lift the existing restrictions which are having such an impact on people right across the country. While there has been and will continue to be uncertainty and fluctuation in delivery schedules, we have purchased more than enough vaccines to vaccinate our entire population. Supply will ramp up. We will vaccinate those most vulnerable and then move on to the wider population, and we will in time see a return to a more normal way of life. Thank you.